Hello everybody, and thank you for tuning in to the weekly report. Listen to the doctors. End the lockdowns. 600 physicians recently signed a letter to President Trump calling for an end to the coronavirus lockdowns. The physicians wrote that far from protecting public health, the lockdowns are causing exponentially growing negative health consequences for millions of Americans. Since the lockdowns began, there have been increases in alcoholism, drug abuse, and domestic violence. There has also been an increase in calls to suicide hotlines. This is a direct result of the mass unemployment and limitations on people's activities resulting from the lockdowns. As long as millions of Americans are sitting at home wondering how to survive until the government says they can go back to work, assuming the lockdowns did not drive their employers out of business, there will be more substance abuse and suicides. At the start of the lockdowns, Americans were told to stay away from emergency rooms and doctors' offices to avoid exposure to coronavirus. This has led Americans to neglect their health. U.S. hospitals have seen a 40% decline in the number of patients admitted for severe heart attacks since March. Does anyone believe that the coronavirus panic just happens to coincide with a miraculous decline in heart attacks? Physicians have also become unable to help many stroke victims who coronavirus lockdowns have kept from seeking medical assistance. Early in the coronavirus panic, hospitals were told to cancel elective procedures to ensure space was available for an expected wave of coronavirus patients. But hospitals were not overwhelmed by coronavirus patients. Beds and other resources were unused. According to the American Hospital Association, this has cost the healthcare providers tens of billions of dollars in lost revenue. Inner city and rural hospitals that already operate on slim profit margins are especially hard hit by the financial impact of the lockdowns. These hospitals may have to cut back on services. Some may even close. This will make it even more difficult for rural and inner city Americans to obtain quality, affordable health care. Postponing needed surgeries will have serious consequences. Many patients whose surgeries have been delayed will find that their once easily treatable conditions now require intensive and expensive care. Some people are foregoing disease management and checkups that could keep them from developing more serious problems. The coronavirus lockdowns have even caused the canceling of chemotherapy treatments. According to the physician's letter to President Trump, the coronavirus lockdowns are preventing 150,000 Americans a month from finding out they have cancer. Skipped routine cancer screenings mean cancer is not detected in an early stage, when it is most easily treated. The coronavirus lockdowns have upended the lives of Americans to protect them from a virus with a 0.2% fatality rate, with the majority of those fatalities occurring in nursing homes and among people with chronic health conditions. Instead, the rational response would be to protect the vulnerable and let the rest of the people live their lives. But politicians and government-anointed experts do not respond rationally to a crisis, especially when a panic reaction can increase their power and prestige. Lesson of the unnecessary lockdowns is clear. Government bureaucrats and politicians, even the media's beloved Dr. Fauci, must be stripped of the ability to infringe on our liberty and prosperity. Thanks for listening.